at the beginning of the session, I mentioned the fact that Britain was very much taking the lead in terms of dealing with this in Sierra Leone. And so I'm delighted to have somebody who has worked with the government of Sierra Leone and across Whitehall to lead the international drive to defeat Ebola in Sierra Leone. And I would like to welcome, to make her intervention, Lynne Featherstone, who's Defence Minister for Africa. Thank you.
Thank you very much. I'm very glad to be here this afternoon. I think it's a very important discussion. It's a very critical juncture in the whole Ebola picture. I think probably what is best if I do is just to give you a straight update. I mean, quite frankly, the speech I had written was all out of date since yesterday. I mean, it's moving that fast, and that's what's so difficult. So, first of all, I talk about the scale. It's an unprecedented outbreak, requires significant and urgent support. I'm sure many of us who've been involved look back to the early days and just wish that we've been up there faster and bigger and to scale, because we've been playing catch up, really. Without further urgent support, the disease could spread well beyond the region with catastrophic consequences. You've had the stats already, so I won't go into that. But if 70% of infected patients are isolated, as David Nabara said, quickly after they contract the disease, then it can be treated. And Britain, at the request of the Sierra Leonean government and under the auspices of the United Nations, is coordinating the international mission to control and contain Ebola in Sierra Leone. I'm sure you know the US is doing Liberia, the French Guinea, and the United Kingdom Sierra Leone in lead terms, but we need more than just 3 countries. In terms of UK action, the UK's £100 million action plan will provide direct medical care for up to 8,800 patients over 6 months. It will also shore up the country's stretched public health services, which has been raised by others, which is absolutely critical to help contain the disease. And this includes support for 700 Ebola treatment beds. With United Kingdom support, we are working with the WHO, who are now training over 120 health workers a week. On the 2nd of October, that's Thursday, we'll be hosting alongside the government of Sierra Leone, and with the president hopefully, an international conference to rally the global community, because there are not enough of us in there helping at the moment. We need an even more effective international response than we've got. And not just countries, we're looking to the NGOs, to the private sector and beyond. I'm sure you know that over 400 NHS workers have now volunteered to help with the Ebola effort in Sierra Leone. I think that's a testament to the selflessness and amazingness of our National Health staff. Volunteers will now go through a comprehensive selection, vetting and training program in the UK and Sierra Leone to ensure that they're ready for the demands of working in Ebola-hit areas. In terms of detail on the 700-bed treatment centre, using British expertise and local building contractors, we will establish the infrastructure for a total of 700 beds. We have a team of 40 military personnel, including logisticians, planners and engineers, on the ground in Sierra Leone to oversee the construction of the UK's facility near Freetown and to recce or develop sites for new facilities. 235 beds in Freetown and Kenema are already in delivery pipeline. That includes a 92-bed facility built by British military and humanitarian experts, as well as 143 beds supported through the Red Cross and Irish NGO goal. In terms of the 92 beds, they come as 12 and 80. The initial phase of the treatment facility will be operational by the end of October. I mean, I was looking at your graph and thinking, oh my goodness. No, but I mean, that's only 8 weeks from the day we said we would do it. But it's nevertheless, this disease moves so fast, it makes you, well, gives great anxiety. The construction of that is about 90% finished as we speak, and that was started in early September. The 12-bed facility is a very important facility. It's a specialist facility. It's site preparations being undertaken by different contractors, overseen by British military engineers, commenced on the 19th of September. First flight of construction materials is 3rd of October, second flight on the 4th. That 12-bed specialist treatment facility is to provide an equal treatment facility as you would get if you came to the United Kingdom, so that facility is there for international health workers to know that the treatment they get there if on a case-by-case analysis it is best for them to remain and be treated in country, they will get the same level of treatment there as they would get here. And that's really to give confidence to international health workers so that they feel that they will be looked after. The MOD will staff and run the facility in its initial phase and will then hand over to Save the Children. Wave at me if I run out of time. Other UK action, I think one of the most important things is a command and control platform. Military and humanitarian experts are setting up a forward command and control hub to provide the backbone of infrastructure, commodities, training and management needed to scale up the response in Sierra Leone. Ensuring the right resources in the right places, and the hub will be staffed by military, humanitarian and health experts, work closely with international partners and with the government of Sierra Leone. In terms of healthcare for health workers, as I said, that UK standard will be offered for those 12 dedicated beds specifically for health workers, and will provide high quality specialist care. In terms of the NHS staff, as I said, 400 workers have volunteered. The government is making sure they get the very best support during their deployment. This will include high quality personal protection equipment, gloves, masks, bodysuits to prevent infection, and they will go through an initial vetting process followed by selection days when they can find out about what they'd be working on. They're going to have comprehensive interview and training programs in UK and Sierra Leone to make sure that they are as prepared as possible. I think they are so brave to volunteer to come forward for this. Working in Ebola hit areas, and the training includes, procedures includes making sure that they're competent in infection prevention and control procedures, confident in using personal protective equipment, and that they have proper support as part of our clinical team and understand safe systems of working. And I would like now just to publicly take my hat off to Médecins Sans Frontières, because they have operated on the front line since the beginning in the most amazing way, and their international staff has such high protocols, they have not become infected. It is possible if you do it right. They'll be vetting on the 29th of September, so yesterday they start, and orientation days begin on the 13th of October. There are other care and infection control services. There's an Ebola command centre in Freetown. To reduce the infection rate, the UK is working with partners to scale up for social mobilisation. These are other things that have been mentioned. Contact tracing and response now. And action has not been quick enough or fast enough. And looking at those graphs, the contact tracing is going to become virtually impossible from that graph you just showed us. But anyway, we have to push as fast as we can. Lastly, the call for assistance from the international community. We have this pledging conference on Thursday. It's absolutely vital. The international community needs to mobilise better and faster. The most urgent priority is for foreign medical and management teams to staff and run new Ebola treatment centres, and they really have to be tip-top. In addition, we urgently need more NGO capacity on the ground to support work at community level. We're doing a lot of thinking on community at the moment, because as this disease increases exponentially, if there aren't enough treatment beds, then we have to go to the source, because where the transmission is in community. And I will leave it there because I'm being looked at.